Good morning, guys. I'm Shayla. I'm an occupational therapy student.
And I'm Kenya, occupational therapy student as well.
And today, good morning. Today we just wanted to kind of meet with y'all and just talk and kind of educate you guys on things about elderly abuse.
Yeah, so just to give like some background information of just like definitions and different types of abuse and things like that. So we have about 5 general forms. You have physical abuse, psychological, emotional, sexual abuse, financial abuse, and then you also have neglect, which could be passive or active. And so just to give you a quick definition for some of these, psychological abuse is the most common form, and this is where you have infliction of emotional pain or distress, and this can be through insults, verbal assault, threats, intimidation, or just refusing to communicate to the older adult. You have financial abuse, and this can be any type of illegal or improper use of the elder's funds, properties, or assets. And then physical abuse is the use of physical force that can result in bodily injury, physical pain, or impairment. And then you also have sexual abuse, and this is where it's any type of non-consensual sexual contact of any kind with the older adult. And this can also be through like exploitation and just non-sexual contact as well. Okay, so you have 2 different types of neglect, and so it could be passive or it could be active. The passive neglect is where you are causing harm unconsciously, and this can be through like limiting the older adult's freedom, like negligence toward providing for like their safety precautions, depriving them of information, allowing malnutrition and dehydration to occur. The active is where you are consciously inflicting harm, and so this could be ignoring emergency situations, not calling physicians out of spite, or stopping important treatments, or just failing to provide essential care for them. And then just the overall like intent with abuse is that it is a willful infliction of damage.
So elder abuse in general can result in a lot of different psychological damage, financial devastation, or just in general physical harm, obviously, that can usually result in death. So elder abuse victims experience a mortality rate that is 3 times higher than people that are not victims. So with that being said, there are 2 different types of risk factors. So one risk factor is called static risk factors, which are basically like fixed things that do not change and usually include historical factors, so like a history of violence or criminality. The other type of risk factor is a dynamic risk factor. So that's basically factors that can be changed or modified through short or long-term interventions. So although both static and dynamic risk factors predict future violence that may happen, or dynamic risk factors, they also play a critical role in violence risk management, since they can serve as effective targets for intervention. So there were some studies that we looked at that showed that increased medical problems or older adults that have chronic health problems are more susceptible for elder abuse. So in particular, one of the highest diagnoses was depression, and that has been identified as one of the most, if not the most common mental health problem associated with elder abuse.
Okay, so now I'm going to go through some signs that you would like to look out for in terms of elderly abuse. That way you can kind of advocate for the older adult if you see some of these signs. And so with physical abuse, you can look out for just any types of bruise, burns, cuts, marks, anything like that just have no explanation for. If you realize that the older adult just has frequent ER visits or delayed medical care, or if there's fearfulness or flinching that you observe around certain individuals. So that could be something to look out for physical abuse. For emotional or psychological abuse, some things to look out for are sudden withdrawal or depression, unusual changes in alertness or behavior, nervousness, fear, agitation, again, around certain individuals. Financial exploitation, look for unpaid bills despite the older adult having adequate income. Sudden changes in banking habits or illegal documents, or missing possessions or funds. To look out for sexual abuse are bruising around the breasts or the genitals, unexplained STIs, torn or stained undergarments, or just extreme withdrawal or fearfulness. And so hopefully by just knowing some of these signs and red flags to look out for, we can just better advocate for the older adult and hopefully decrease the prevalence of elderly abuse.
And then some kind of direct ways that y'all as a community can just help prevent elder abuse is, number 1, staying aware and educated. So obviously, like this little seminar that we have, you are getting educated on things that will help you like learn the signs of elder abuse. Also, building strong social connections. So isolation is one of the biggest risk factors. So even in things that you do in the community, like if you volunteer at places, at the church, your neighbors, just try to check in regularly with older adults and try to help them stay engaged in social activities. Like I said, even if it is like a small social conversation. And then reporting and speaking up if you do see anything that is concerning. So you could do that can be there are a few hotlines that we can provide y'all with that y'all can contact, or just local law enforcement, or there is an adult protective services system that you can also, and this can also be like if you're unsure, it's better to report something that is suspicious than not saying anything at all.
I would like to ask some of y'all to kind of give me back some of the signs and things that I mentioned to look out for, and red flags to look out for in terms of elderly abuse.
Okay. Any bruising, any burns, any unexplained marks on the body, delayed medical care, unpaid bills when the older adult has adequate income, marks on the breast.
Okay, good. Okay, can y'all remember? Oh,
Yeah.
yep.
Mm-hmm.
How many fearfulness from the elder adult?
Flinching.
Mhm.
Right.
Good, great job, guys. Okay, do y'all remember any of the kind of like the 3 most important ways that y'all like in your day-to-day life can do to try to help prevent elderly abuse?
To stay aware and educated, build strong social connections with older adults, and speak up and report anything that we see that's
Yes.
suspicious.
Any group education, things like this.
Yeah. Do y'all have any questions for me? Any questions, comments, or concerns? Yes.
I do. I know you said, like, of course, when we're seeing different signs of elder abuse, there's different ways we can report them. Can you go over the different ways you said we can report them?
Yes. So, local law enforcement, obviously, we all got the contact for that, but adult protective services and elder abuse hotlines. And before you leave today, we'll have a little packet by the door that you can grab that has like the phone numbers for each of those, so that way you can kind of have them on hand for you. Any other questions? Great. Have a good afternoon.